Thank you for joining us. I am Manesh Patel from Duke University, and I'm at the Heart.org booth here at Orlando American Heart Association meeting 2012. With me, I have Dr. Nielsen here to talk about the MANTRA-PAF study, some new information in our patients with paroxysmal atrial fibrillation. Thanks for joining us.
Thank you for inviting me.
Can you tell me a little bit about the background and study design?
We do thousands of ablation for catheter ablation, for atrial fibrillation every year, and we have very little information from randomized trial on what to do. This is the first larger scale randomized comparison of catheter ablation and antiarrhythmic drug treatment as first line treatment in patients with paroxysmal atrial fibrillation. It's an international multicenter randomized trial including 294 patients randomized into two groups. They were followed with sequential 7-day Holter recordings for 2 years.
Wonderful. So around 300 patients, paroxysmal atrial fibrillation, randomized to ablation or antiarrhythmic therapy. Wonderful. What were the findings?
The main findings were that at the 2-year follow-up Holter, AFib burden was reduced significantly in the catheter ablation group, as was number of patients with any asymptomatic atrial fibrillation. Quality of life was better in the catheter ablation group after 1 or 2 years.
Yeah. So quality of life and AFib burden was less. Were there any adverse events?
We had some adverse events in both groups. They're an equal number in the two groups, but we also had a stroke that was fatal, a perioperative stroke. We had some tamponades. We had a few patients with one-to-one conducted atrial flutter. So yes, there were a few serious adverse events, but an even number in the two groups.
Interesting. So what did you guys conclude, and what do you think are the next steps?
We think that this study shows that in patients like those we included, relatively young, 55 years in mean, without much comorbidity, catheter ablation is at least as good, probably a little better than antiarrhythmic drug treatment. And in these patients, we believe that both treatment options should be discussed with the patients, both antiarrhythmic drug treatment and catheter ablation, before deciding what to do. These data cannot necessarily be extrapolated to be valid also for elderly people with more comorbidity.
Well, thanks for sharing your results with us.
Thank you.